mentioned some major challenges for the field, and indeed, health psychology is evolving rapidly in response to these challenges. What do you think is the most pressing issue facing health psychology today in Europe or globally?
Okay, well, I'm not a health psychologist myself, but as a public health researcher, I'd say one of the most pressing challenges in public health research, and I believe this is equally relevant in health psychology as well. A challenge would be how we move from studying individual behavior to understanding behavior as a property of systems. And there's excellent behavioral theories, models, but too often we apply these models primarily at the level of the individual without sufficient attention to the wider conditions and context in which the behavior of a whole system is produced and sustained. I'm referring to the sociocultural setting, organizational, policy environment. Take maternity care, for instance, as an example that I will be referring to in my keynote speech. In Cyprus, cesarean sections exceed 60%. This is not because, as the data would tell us, or rather lie to us, a large proportion of them are elective cesareans. This issue cannot be simply understood as the result of individual women's preferences. Those preferences are shaped by a whole system, by so many factors, well beyond the person's control. Professional beliefs, attitudes, perceptions, fears, you name it, professional roles, power dynamics, sociocultural norms, the risk culture in general of a society, organizational characteristics, constraints of the system itself. So finding a way to move from the individual to the system level is not easy, but I think it's necessary. And ultimately, most of the pressing challenges in public health and health psychology are systemic problems. So addressing them requires, I think, stronger focus on understanding the behavior of individuals, but also the behavior of the whole system, to because it's the only way to affect change. I know this is easier said than done, but we need to find a way to move towards understanding the behavior of a system as a whole.
Mm-hmm. Great, thank you. Addressing systemic issues is really important and requires translating research into meaningful changes beyond academia to impact policy practice and public health. How do you think we can better achieve this translation into a real world impact?
Yeah, well, for research to have a real world impact, I think we need to shift from a primarily evidence to policy model to policy and practice orientated research approach and design. Think about it. For at least 2 decades, if not more now, we've been talking about evidence-based policy, evidence-based practice, but we know that generating good evidence is not enough. Generating good evidence and hoping that policymakers, practitioners will find this research and use it is not enough. It doesn't always work, not in every setting. And hence we talk about research practice gap. In reality, impact is much more likely when research is designed from the outset to address a clearly defined policy or practice problem, what we will call policy or practice orientated research. I think this means closer collaboration with those who will ultimately use the research right from the beginning: policymakers, healthcare professionals, managers, service users, and advocates for change. And of course, a prerequisite for that is a shift in mindsets, not just mindset of others, but a mindset of our own, and a shift in our own methodologies. I think we need a shift towards more participatory approaches, implementation-focused research. In practice, it means we need to reposition ourselves as researchers and reframing the very questions we ask. For example, in my line of work, instead of asking how women experience maternity care in Cyprus, we can phrase the question a little bit different. We can ask, how can we work together with women service users to promote reflection amongst healthcare providers about the current reality of suboptimal care in maternity practices, and what needs to be done to move towards a framework of respect to maternity care. And some of these things that we will identify, are they things that we can start doing ourselves as part of this project? Can we sit and co-design some solutions to these issues? I think when the research community engages with real world challenges, gaps, and of course in the process we will engage with power dynamics. And believe me, there's many power dynamics. But research then becomes more likely, I believe, to translate into meaningful change.
Mhm.
In that sense, I think it also addresses a quintessential question in research. Should us as researchers, should we see ourselves primarily as the impartial producers of research evidence, or shall we start seeing ourselves as active advocates and contributors of change?